Hey everybody, hope you're having an awesome day. Today I am going to be talking about the benefits of CBD oil and excessive worry. So of course, as you know, I cannot name the diagnosis. However, I will, as always, go ahead and list the article that I have referenced, or articles I should say. So fear and worry are like adaptive responses as long as they're like a normal level, right? So it's adaptive for us to cope and with threats and survival. So when they become excessive and keep us from sleeping, or so bad that even some people can't even work. Some people can't do their daily functions. And when it becomes maladaptive and it leads to disability events, such as not being able to work and things of that nature, it's excessive. It interferes with people's lives, and they can no longer lead their life the way that they once were. Of course I can't name the diagnosis, but, the way that they're being treated right now is prescriptions. And, we all know that many prescriptions not only have side effects that maybe another prescription would be prescribed to combat, but when you get off of these medications, that has to be tapered. The reasons that they have to be tapered is because they are toxic. And when you have something toxic in your body and you just cut it right out, you're going to feel 10,000 times worse than what you did when you're on the medication. So these medications do not heal. They do not cure this disorder. They just, they try and help people to get through their day, okay? They don't always work, and like I said, they're toxic, and it's harmful for people just to stop taking them altogether. So, that said, this disorder, it's not a disorder, it's a disease. It's a disease. It's in the DSM, it's diagnosable. Counselors, therapists, psychiatrists, and doctors use this disorder to diagnose people all the time, and they bill for it. But here's what happens with it. People end up getting a diminished sense of well-being. There's elevated rates of unemployment with people with this disorder, relationship breakdown, and then elevated suicide risk. So it's no joke. It's absolutely no joke. However, studies have shown, and I will go through those shortly here, that cannabis with an increased CBD to THC ratio has been extremely effective in helping people with this disorder. It's amazing. Pharmacologically, CBD interacts with several receptors known to regulate fear and worry-related behavior, specifically activating CB1Rs, produces effects in various models of unconditioned fear. I'm looking at my notes because I don't have this memorized. I don't have time to memorize stuff. Unconditioned fear, relevant to multiple worry disorder symptoms, domains, CB1R activation. It enhances fear extinction and can prevent fear reconciliation. So what this saying is, or what this is saying, I should say, is that when you introduce cannabis oil from the hemp plant, right, because the hemp plant offers CBD proportion extremely higher than THC proportion, it helps with those receptors in the brain to reduce the fear, to reduce the feeling that, living in constant worry. It's debilitating. This is what pharmacology is trying to do with drugs, as I previously mentioned, and they are somewhat successful. However, they also introduce side effects, which I talked about, from the drugs, and patients must taper off them over time, because stopping cold turkey can be extremely dangerous and cause added psychosis. So, on to my studies. And I'm just going to read these from here because it's not my work. But a single CBD dose of 400 milligram This is pure CBD. We're not talking about CBD oil that people are selling that has coconut oil or olive oil or anything else in it. Pure CBD, what I offer, reduced anxiety in a brain imaging study. So this is an MRI of 10 people with seasonal affective worry. You guys know what I'm talking about. It reduced blood flow to the parts of the limbic system in the brain where that is elevated when people are having these episodes. In a study of 10 healthy volunteers, 300 milligram of healthy as in physically healthy, okay? 300 milligram of CBD reduced these symptoms that I previously talked about after a stressful task. So lots of times this disorder may happen before someone is doing public speaking or before they are, you know, if they're out socially. Sometimes people can't be out socially because they are so revved up and like feared up about the whole situation that they can't even go outside, and go to like a birthday party or go to dinner with people because this debilitating disorder and disease keeps them from doing things. Let's see. So this also goes on, and of course I will list the article that I used, but it talks about various disorders of this disorder, if you will, and how it can and will help people in those instances. Yeah, and then it goes on to some other things too, which I don't want to get into because I want to keep this right to the one disorder that I'm talking about. So again, just to recap quickly, fear and worry are adaptive responses essential to coping with threats and survival. However, some people don't necessarily just have the ability to keep fear and worry at a minimum to help them stay out of sticky situations and to survive. When that happens, it may lead to maladaptive situations where people can't go out in public, where they can't sleep because their brain is constantly going nonstop, worrying about things. And it can, it's associated with people not being able to work, not being able to go out in public, relationship breakdown, and suicide risk. If anybody has any questions about this video, please contact me. More than happy to talk about CBD as always, and I will post the articles. Have a wonderful day. Take care, everybody.